Hello, and a very warm welcome to our distinguished speakers, guests, and friends joining us from all over the world. My name is Dr. Lerato Pitso. I'm a public health medicine specialist, also currently holding a position as a financial director for Women in Global Health, South Africa. We have gathered here today, all of us, to voice collective insight to a critical topic in global health: prevention of sexual exploitation, abuse, and harassment. This is the first civil society organization-led regional conversation on the topic. So please introduce yourself in the chat and send your questions for our speakers, or share your thoughts on Twitter using the hashtag that we have put in the chat. We want to hear from you. Today, we will be hearing from inspiring women and men from governments, non-government organization, United Nations Agency for our East and Southern Africa Regional Town Hall meeting titled Collective Responsibility, Collective Action. I will now introduce and hand over the stage to Dr. Magda Robalo, our woman in global health.
Thank you very much, Dr. Lerato, for giving me the floor. I would like to acknowledge the video message from Her Excellency, the Minister of Health of Malawi, Honorable Khumbize Chiponda, who unfortunately couldn't join us online. I want also to welcome you, Dr. Lerato Pitso, our esteemed moderator. Welcome our distinguished panelists, our dear participants. Welcome to everyone. On behalf of Women in Global Health, I would like to thank you for joining the first regional town hall meeting on prevention of sexual exploitation, abuse, and harassment in global health, organized by the Women in Global Health global team in collaboration with our chapters in Women in Global Health South Africa and Somalia. My name is Magda Robalo, and I'm the Global Managing Director for Women in Global Health. Approximately 1 in 3 women globally has experienced a form of violence against women during a lifetime, with significant impacts for their physical and mental health, as well as measurable costs and consequences for the whole of society. Violence against women is a systemic problem in all countries and all sectors. And women and children in conflict and emergencies are at the greatest risk of sexual exploitation and abuse. We have examples from so many countries, from Haiti to the Democratic Republic of Congo, and today in Ukraine. The list of countries is unfortunately quite long. It is an appalling fact that some privileged and powerful men in the global health sector sexually abuse and exploit the vulnerable women and girls they are employed to protect. Those men come from all sectors. They come from UN agencies, they come from governments, from international organizations, from the private sector, and from NGOs. As NGOs, we have joined together to ask what it will take to end this abuse once and for all in global health. In March of this year, Women in Global Health convened a global town hall meeting with Feminist and Actions pour la réinsertion sociale de la femme that highlighted the need for regional level coordination and collaboration to ensure a survivor-centered approach to eliminate sexual exploitation, abuse, and harassment. Boys and men can also be victims of sexual abuse and exploitation, but we believe the majority of victims are female. It is heartbreaking and unacceptable to witness these power asymmetries being exploited by powerful predatory men. The health sector is not immune to the perverse and pervasive effects of this toxic combination and exploitations, making communities in need of assistance, as well as women healthcare workers and colleagues, vulnerable. Since men are the majority of perpetrators, this is a man's problem, not a woman's problem. But typically, it is women who work to find solutions. We cannot make it the responsibility of women to change men's behavior. We must take men and all decision makers accountable. Sexual exploitation, abuse, and harassment is a common problem, more frequent than it is reported. Sexual exploitation, abuse, and harassment is a human rights violation. Therefore, prevention of sexual exploitation, abuse, and harassment is a collective responsibility requiring collective action. It is the responsibility of civil societies, of the United Nations and its range of agencies and programs, and other organizations, multilateral organizations, governments, and the private sector, communities and individuals as well, and other actors. There are 4 things we really need to put in place. We need to put prevention and justice systems in place. We need to work together to protect survivors and victims. We need to put prevention and justice systems in place. And we need to ensure transparent reporting and investigatory mechanisms and accountability measures. Women in Global Health is actively advocating for working in advocacy to ensure safe and decent working conditions for healthcare workers, including prevention of sexual exploitation, abuse, and harassment. To support the global advocacy work and build evidence-based policy measures, we are finalizing an anonymous web-based platform to collect stories of work-related sexual exploitation, abuse, and harassment from women healthcare workers across the world. We will be sharing more information on this platform with you once the platform is ready and launched. We are also advocating for NGOs, especially women-led organizations, to be a central part of the solution. We need a multi-stakeholder approach because women's organizations know best how to keep other women safe in their context. It is critical that women from regions and countries most affected in the Global South are seen as experts and assets and not merely as victims. And this is at the very heart of our meeting today. Women in Global Health is also saying clearly that women's underrepresentation in leadership and decision-making increases the risk of sexual exploitation and abuse. Women hold 70% of jobs in the health sector, but only 25% of decision-making roles. Equal leadership for women at all levels, from community to global, will be a game changer in prioritizing prevention of sexual exploitation and abuse and driving solutions. In closing, Madam Moderator, I want to say again that sexual exploitation, abuse, and harassment is a human rights violation that can never be excused or tolerated. I believe this town hall will open doors for further conversations and joint engagements at the regional level to end sexual exploitation, abuse, and harassment and its health, societal, and economical impacts. I'm delighted to hand back the floor now to our moderator, Dr. Lerato Pitso, to lead us through the session. And once again, we are grateful that you have joined us. We are looking forward to hearing your experts, our expert speakers, and to hearing from you all. Thank you for being with us today.
Thank you. Thank you so much, Dr. Magda Robalo, for your warm welcome and also for the insightful points. It is indeed quite as sad to hear that some of our leaders that are supposed to actually be out there in different countries providing aid are the ones that are perpetrators to this horrific topic that we're discussing today. This has clearly affected a lot of people, our friends and families. So I hope today, all the discussions that we'll be having today will give us, even those at home, our participants, a way forward how to deal with sexual exploitation, abuse, and harassment in our own country, in our own workspace. So thank you for those insightful and very informative background to what has led us to have this conversation and this webinar today. Thank you very much, Dr. Robalo Magda. Now I will move on today. Our keynote presenter, which was the Honorable Khumbize Kandodo Chiponda. She's the Minister of Health of Republic of Malawi. Unfortunately, due to unfortunate circumstances, Honorable Minister will not be able to do a live keynote presentation. She has sent us a video. So I will lead my team to present this video just after I have formally presented her. Honorable Khumbize Kandodo Chiponda is a seasoned politician who is serving as a member of parliament for Kasangu Southeast constituency for a second term. She is a fierce advocate for gender equality. She holds a Bachelor of Science majors in biology, chemistry, including pharmacy. She has held different roles in various organizations, including the Ministry of Health before her current role. In her absence, we are truly honored that despite the unfortunate circumstances they are facing in their country, Malawi, she has presented us with a video of a keynote speech. I'll lead my team to just present the video. Thank you.
The Global Managing Director of Women in Global Health, Dr. Magda Robalo, our development partners, civil society groups, distinguished guests who have joined us online, ladies and gentlemen, all protocols observed. A good afternoon to you all. I would wish to thank you for organizing this stakeholder meeting that seeks to strengthen coordination for partners working on preventing sexual exploitation, abuse, and harassment, and achieve renewed commitment from the stakeholders towards preventing and responding to SIA. These words, sexual exploitation, abuse, harassment, are applicable among our workforce or to our women, girls, and boys, especially in humanitarian settings. At no cost should any of our countries or indeed organizations tolerate SIA, rather it should be zero tolerance. This meeting has come at the right time when most of our countries are struggling with issues of sexual exploitation, issues of abuse, and issues of harassment. It is high time we join our hands together and agree on mechanisms to prevent and respond to SIA in a timely and fair manner. Invited guests, we have 8 years to attainment of the SDGs, Sustainable Development Goals. SDG number 3 talks about good health and well-being, while goal number 5 talks about gender equality, and goal 10 talks about reduced inequality, and these cannot be met if SIA is not addressed. You would agree with me that women and girls will not reach their full potential if they are sexually exploited and live in fear. Honorable Chairperson, ladies and gentlemen, realizing that SIA is rampant in most of the countries, I have decided to share the Malawian context, which some of you will agree with, as it is the same situation that you are facing in your own countries. Malawi is one of the countries that has been hit hard by disasters in the past recent times. Other than COVID-19 pandemic in 2022, Malawi had devastating cyclones. We had Cyclone Ana and Cyclone Gombe, which heavily affected almost 19 districts of Malawi. These floods affected over 990,000 people, with more than 190,000 being displaced into temporary shelters. During emergencies, women, girls, and boys are prone to exploitation and abuse in the internally displaced persons camps. As such, response has to be handled in such a manner that reported acts of SEER are investigated and acted upon with urgency to prevent prolonged torture of victims and also survivors. Malawi is a home to refugees and asylum seekers from various African countries who are kept in camps, and acts of SEER, which is sexual exploitation, abuse, and harassment, can also happen in these camps, such that there is need to be vigilant in order not to miss these acts. Honorable Chairperson, ladies and gentlemen, my ministry, in collaboration with our partners and other stakeholders, has implemented the minimum initial service package to ensure that the workforce is equipped with knowledge, skills, and attitudes to respond to disasters, including SEER. The stakeholders training of our health workers and social welfare, police, and members of the protection clusters and civil societies was done in order to strengthen the synergies and coordination in handling sexual exploitation, abuse, and harassment. The collaboration among different stakeholders and government line ministries is key for the positive outcomes in preventing and responding to SEER. Honorable Chairperson, ladies and gentlemen, this SADC Sexual and Reproductive Health and Rights Strategy of 2019 to 2030 commits to eliminate sexual and gender-based violence and other harmful practices, especially against women and girls, among others. Countries are expected to operationalize the strategy by putting mechanism to end GBV. In line with this, Malawi government has recently embarked on a number of strategic and programmatic actions aimed at preventing SEER and also strengthening a response. These include orientation of the district rapid response teams on SEER, prioritizing the disaster-prone districts, and districts also have developed action plans on how they will mainstream issues of SEER. This will go a long way to have improved preparedness plans on SEER and also strengthened coordination among the teams. There is need for continued community sensitization on issues of SEER so that they are able to report cases instead of protecting the perpetrators. In addition, there is need to ensure that referral pathways are fully functional. It is also imperative to put mechanisms of reporting issues of sexual exploitation, issues of harassment, and issues of abuse incidences in the internally displaced persons camps to ensure timely response. The work of PSEA would not have been possible without collaborative efforts between my government and its partners, in particular the United Nations agencies. The Malawi government appreciates the technical and financial support from all stakeholders in the fight against SEAAH. I urge fellow SADC countries and Africa and all the continents to implement strategies to end sexual exploitation, abuse, and harassment as we strive to achieve a better world where mothers, children, and adolescents will survive, thrive, and indeed transform the globe. Honorable Chairperson, in conclusion, as we are forging ahead with PSEAH, the global stakeholders need to reflect on the existing gaps in PSEAH programming. The stakeholder need to commit and extend PSEAH to all vulnerable and marginalized groups, including women, girls, and boys in humanitarian crises. A strong coordination among stakeholders remain key among other strategies. Honorable Chairperson, ladies and gentlemen, I thank you so much for your attention. God bless you all.
Thank you very much. I would like to thank Honorable Minister Khumbize Kandodo Chiponda in her absence for her encouraging words. Indeed, SEER is a joint effort for all countries. It's everybody's problem to address it. And I'm quite honored and encouraged that Malawi is taking part to fight against this global threat that threatens the attainment of Sustainable Development Goal number 5 on gender equality, and also addressing some of the key issues Dr. Magda Robalo addressed of underrepresentation of women leaders in all the humanitarian agencies and non-government organization. So without further delay, I would like to introduce our high-level panel. The first one that I will introduce, our first panelist, is Dr. Catherine Saucy. Dr. Catherine Saucy is a United Nations resident and humanitarian coordinator for Ethiopia. She has more than 18 years cumulative international experience, has worked in numerous countries, including Zambia, South Africa, China, and as a United States Regional Director, East and Southern Africa. In her current role, she fosters engagement with government, civil society, bilateral, multilateral partners, academias, private sector to enable the United Nations Development System to address national needs, priority, sustainable development challenges to advance the 2030 agenda for the country. Our second panelist is Ms. Masana Mulaudzi, Programs Director at Sonke Gender Justice in South Africa. She is an economist, a civil society actor with over 12 years experience working on violence prevention, social cohesion, economic justice, feminist practices, social movements. At Sonke's Gender Justice, she oversees organizations pragmatic work for enhanced impact towards achieving gender equality. Now, going to our third panelist of today is Dr. Michael Ebele, a regional humanitarian advisor for United Nations Population Fund in East and Southern Regional Office based in Nairobi. He's a public health practitioner with a medical background, having over 20 years experience in sexual and reproductive health and gender-based violence at sub-national, national, and international levels. Our fourth panelist is none other than Ms. Wairimu Munyinyi Wahome, Executive Director of Coalition on Violence Against Women, and she is based in Kenya. She is an advocacy and policy specialist with over 16 years of international experience, including in Namibia, Somaliland, Sierra Leone, and more recently in Kenya. Wairimu is a passionate gender and development issues and is keen to see that laws and policies in development accord women and girls in their rightful place in the mainstream agenda. Ladies and gentlemen, I will be asking our panelists 2 rounds of questions before we open the floor for the Q&A from the participants. In the meantime, I encourage all the panelists to directly answer the questions for the specific question that is posed towards them in the Q&A box. Just to kick off our conversation today, I will start with you, Dr. Catherine Saucy. I know as a United Nations resident coordinator for Ethiopia, can you kindly just tell us more about your work that you're doing in the humanitarian and health sector, and how are you addressing some of the challenges, which one of them is addressing the lack of strong coordination and multi-stakeholder collaboration to prevent SEER.
Thank you. Thank you very much, Dr. Pitso, for the kind introduction, and would like to thank the Women in Global Health for giving me this opportunity to take part, to listen to the expertise on the table, and also to share what we have been doing. I think that I'll just start off very briefly because I know there's not much time, but just to highlight that the context in Ethiopia is complex and complicated. The overall humanitarian situation in Ethiopia continues to deteriorate with increased humanitarian needs due to several crises, principally ongoing active conflict in several regions. We have climatic shocks with droughts again in several regions, following 4 consecutive failed rainy seasons and probably a 5th coming up, and now floods. And in several parts, we've got the 2 conflict and the climatic shocks happening at the same time. We've got in Tigray, banking, fuel, electricity, movement of commercial commodities not being provided. And of course, the impacts at household level due to the economy, consequences of COVID-19, and the geopolitics leading to high inflation rates. The impact of this, of course, is that we have more than 20 million people who are estimated to need humanitarian assistance and protection this year. Our efforts in responding to the people in need, and the majority, over 75% of them, are women and children, are collective, working with the government at national and subnational levels through what we call the Humanitarian Country Team, which is composed of 9 United Nations reps, with OCHA, country directors representing national and international NGOs, ICRC, and of course, the donors, utilizing a cluster system around what people need at any particular point in time: health, education, nutrition, water and sanitation, food, etc., and of course, the most important, protection. The HCT is duplicated at subnational level in all the regions where the people in need are. We have a very large footprint as humanitarians across the country. Everywhere we have access, we are present. SCAH harms the people who we seek to protect and assist. And what Dr. Magda said at the very beginning, this contradicts the very humanitarian and human rights principles on which our actions are based, and is an illustration of our protection failure. We're also working in a context that the patriarchal norms, the gender inequalities, and the discrimination against vulnerable groups, combined with the lack of a very strong legal and policy framework to provide an environment where SCAH is widely tolerated in society. So in all our efforts, led by myself to prevent and respond, I have strived to ensure that we as the UN are not then part of the problem. My role as the RCHEC is to ensure that the UN and the humanitarian community take a collective and coordinated approach to prevent and respond in all our operations across the country. I, as the RCHC, have system-wide accountability to follow up on strategies, the interventions, and to ensure appropriate complaint and response mechanisms are in place. My job basically is to ensure we better prevent, we detect, we report, and that action against personnel who commit these inexcusable and abhorrent acts is taken. And this is embedded in my performance appraisal, reporting directly to the UN Secretary General and the Emergency Relief Coordinator. In addition, every UN and NGO leader has a responsibility on SCAH, not only on the efforts on prevention, but also in responding to any allegations reported, including investigating cases and providing support to the survivors and protection of the whistleblowers. The investigations are done by the agencies using their own internal procedures. The agency heads, WHO, UNICEF, UNFPA, etc., are responsible to inform me on every case reported at any level. My office does not do investigations. However, my role is stated is to ensure follow-up of the survivors and increasingly protection of the whistleblowers, which I hope to learn more of during this panel. We made the decision to develop the joint accountability mechanisms. We've established an interagency PSCH network at national level and is currently chaired by the representatives of UN Women and UNFPA, with members drawn from the UN reps of WHO, UNICEF, UNFPA, and other humanitarians, and it's supported by somebody in my office, a coordinator. We have a one strategy and an annual work plan, which I make sure is resourced, and in order to ensure that we deliver on the many continuous activities that are required to keep the agenda alive. Since we have established this, we have been able to establish sub-regional networks in the regions with dedicated SCA staff and standard operating procedures. Every entity has appointed a focal point with clear terms of reference, stipulating time that needs to be dedicated to SCA and linking with the human resource, for instance. We've endorsed the SOPs for all the agencies, so it's one across the system, and we've developed information campaign materials with linked information, education and communication materials in local languages. We've also designed and implemented training, and at this present time, all over the country, we have 180 SCAH focal points working across the clusters, because it's not just about health, but everywhere that we around the needs of people and the partners. I conduct field missions for to keep the raising the zero tolerance, and in addition, often conduct joint missions with the network co-chairs to mobilize and support the agenda, and to ensure that the national and local authorities are fully involved and understand their role in protection. Most of what I have received this year has been reported by active bystanders from within the UN system, leading to follow through directly with the agency heads. I've also had reports implicating local service providers necessitating working with the local authority. However, there was reluctance from the individuals in the community to report and follow through. I believe that more cases from the community are not reported due to several barriers, particularly stigma and discrimination in the community, fears around family reputation and other negative consequences, requirements by police and courts to produce witnesses, etc., and the lack of follow-up when cases are reported. The main challenge, I think, for us, even with the strong coordination, is to enable victims of and survivors of SCAH to break their silence safely and effectively. I will stop here in terms of the coordination. Thank you.
Thank you so much, Catherine. That was indeed a mouthful, and thank you for championing this incredible work in Ethiopia. I understand it's quite difficult with the current economic situation that is happening in your country, and to add this problems with SEER is also another form of just increasing the burden that our vulnerable people are already facing in the African region. But thank you so much for all the hard work that you and your team and all the support. We understand that it's not all the United Nations and not all those organizations are involved, all the workers involved in committing the sexual misconduct to our people. So thank you so much. And then I'll get back to you with more details with follow-up questions. Now, I would like to take this opportunity to go to our second speaker, Masana, Ms. Masana Mulaudzi, Program Director of Sonke Gender Justice. As a leader, Masana, of a civil society organization in South Africa, specializing in addressing gender-based violence and SEER. Can you tell us about your work and how do we, because some of the issues that, even from Catherine, we have identified strategy to identify, we have identified strategy already to protect, we have put measures in place, but ultimately the victim, the survivors, what exactly are we doing to ensure that we are shifting our focus to victim survivor approaches to address, and what kind of intervention do you as an organization in South Africa have put in place to address SEER? You may take the floor.
Thank you so much, Dr. Pitso, and it's such a privilege to be amongst such esteemed colleagues. And thank you to Women in Global Health for the platform, I think, to learn and to share. and cross-pollinate, because as Dr. Sozi mentioned, we're at a moment of crises, and we keep coming back to these moments of crises. One of the things that was really interesting for me on the backdrop of the Generation Equality Forum and the excitement around the Women's Global March and International Women's Day is that still, as countries were rolling out their COVID-19 response, there was no accountability for gender-based violence. Many of the initial lockdown plans were completely gender blind. And so you tend to see over and over again that there's this not only gender neutral or gender blind approach, but gender regressive approach that fails to account for how something such as locking a lockdown approach or a public health measure, which seems far removed from gender-based violence, could have such far-reaching effects on women and girls and children across the world, and in particular in Africa, as the hotlines that were run by national governments took off. And so for me, I think, you know, one of the questions around survivor-centered policy making and policy response, not just to gender-based violence more broadly, is, are we thinking about the lived realities of women and girls as an afterthought, or as integrated within our programming and our planning for crises, for opportunities, for policy planning and making and implementation? Just a little bit about Sonke Gender Justice. You know, we started as an organization that many people think that we were started as an organization by men responding to gender-based violence. But it was really an organization founded by a collective of feminists working together with male allies to identify where is the gap in the response to gender-based violence. And as many would know, that our work has really centered on masculinities, wanting to respond to patriarchy and toxic masculinities at the interpersonal, social, and structural level. Of course, what we've seen, you know, as the work of masculinities has taken off, is really that it's focused on interpersonal relations, right, and social relations. So how do we work with traditional leaders? How do we work with individual men who are perpetrators and enhance their knowledge of gender-based violence and gender equality and what it is to apply a gender transformative approach? Some of the things that we've then since begun to grapple with as an organization, and I think this is true across the board for organizations led by women working on masculinities, is that this work must be deeply accountable to the feminist movement and to women's rights organizations. Because the danger of working on masculinities in the absence of that is the narrative of men as protectors, men as having some unique or wonderful characteristic that validates and mandates a new type of patriarchy that is masked or is masking really violent assumptions about the equality and dignity that are inherent rights of women across the world. So we've been doing a lot of work around ensuring that the work on masculinities not only looks at interpersonal and social relations, but also at structural relations that enable and facilitate the entrenchment and enforcement of patriarchy across the continent. This includes that in our survivor-centered approach that we're working very closely on referral systems and community education and mobilization, having women leaders and feminist leaders in particular at the forefront of the response to gender-based violence. This work has been really exciting because what you then begin to see in the survivor-centered approach is that really we have a lot of systems at the community level that can support a response to gender-based violence. This includes court monitoring. Oftentimes, victims are sent to courts by themselves. Court dates are pushed further and further back, or they're facing moments of intimidation when they're reporting on cases, or even in the moment of seeking medical care and support and investigation in support of their cases, that they then encounter a really isolated and stigmatized process. What it looks like to have a community collective, who we call our community action teams or CATs, at the forefront of journeying with survivors through the process of reporting to the process of finding, and thereafter, what does it look like to rebuild your life, has been really integral to shifting and shaping the work that we do. But we know that this is not enough. Many times our community action teams and our community-based organizations with whom we work are under-resourced and stretched, and the cases are far exceeding the availability of people on the front lines. It's a really tough and lonely and isolating work with high levels of burnout and mental distress. We need to pair this with more structural interventions, which has really been a process by which we enable policy development and advocacy, by which we stand in solidarity to ensure that not only are we working on the response component, but also the prevention component. In South Africa, this has also looked like the amendment of our domestic violence legislation, and it's fantastic to be part of this conversation, where the state has recognized that even for medical practitioners at the site of receiving a patient, there is a duty of care, there is a responsibility to monitor and track that case, which was often not included in legislation. So there was a very clinical approach that divided the person seeking assistance and medical support from really getting accountability at the point where they were ready to then report and take their case to court. So even if a victim or survivor would then say, I'm not ready to report on the case, we do need there to be the availability of evidence that then supports the case when they are ready. We do need a whole systems approach. I'm grossly over time. I'm trying to run through this very quickly. And I think maybe very quickly, one of the things that's important in thinking through these sort of systems change for a victim and survivor-centered approach is really recognizing how deeply entrenched patriarchy and toxic masculinities are, not only within those interpersonal and social relationships, but also within government policy and planning, right? There is an inherent misogyny that exists that considers women to be secondary citizens in its implementation. And I think in the second question, I'll try and unpack some of the ways in which we can collectively begin to respond to this challenge. Thank you so much, Dr. Pitso.
Thank you so much, Masana. Your organization is doing a great job, but we will unpack it. As you mentioned, there's quite a number of strategies that you've already started, which we are quite grateful. And some of the issues that you're raising are very much important. How do we deal with some of the issues that promotes and actually give SIA a platform within our workplace, within our organization? What are the leaders or politicians doing, and how can we get funding that is needed to have to broaden and reach those vulnerable communities, especially with the dynamics of how South Africa is? It's difficult to reach those key population that find themselves vulnerable. And I think this is happening everywhere with the recent incident that we've seen on during the 10th Ebola outbreak in the DRC. So thank you so much for those insightful, formative actually, viewpoints from your side. I think I will move on to our third panelist, Dr. Michael. Let's hear from you. As a regional humanitarian advisor for the United Nations Population Fund, Eastern Sovereign Regional Office, ESARO. Dr. Ebele, I know from my understanding that UNFPA has zero tolerance when it comes to prevention of SIA. Please elaborate and tell us more. What is it that you're doing more specifically in the ESARO region to respond to the prevention of sexual exploitation, abuse, and harassment in the continent, especially looking closely in the humanitarian and health sector?
Thank you, Dr. Pitso. And again, a very big thank you to Women in Global Health for offering me this opportunity to be among these distinguished colleagues and members attending this town hall meeting to try and see how we can put our heads together in addressing the elephant in the room, which is sexual exploitation and abuse and harassment. Yeah, as Dr. Catherine and Ms. Masana pointed out, this is collective action, and really, as UNFPA, we don't go it alone, but work very closely with all partners. And Some of the work we do has already been pointed out by Dr. Catherine and again, Ms. Masana, but I'll just try to focus on a few specific actions we take as UNFPA. As you may be aware, exploitation, abuse, and harassment is very, very linked to one of the UNFPA's 3 transformative results, which is ending gender-based violence and harmful practices. Again, in line with the achievement of the SDGs, as mentioned earlier, SDG 5 specifically. So as the previous speaker pointed out, many times you'll find that PSEAH is actually kind of put away from normal GBV programming, which seems to have taken quite picked up traction. So as the global lead for GBV programming, especially in humanitarian settings, one of the actions we have undertaken is actually to try and bring all the actors together, provide some guidance on how we can mainstream prevention of sexual exploitation, abuse, and harassment into gender-based violence prevention and response, because there's a lot of work going on out there on GBV prevention and response, but many a time you will find that elements of PSEAH are left out. So we have developed modules, training modules for frontline humanitarian workers who really find themselves at that point where they're serving the communities in need, where there are limited resources to respond, and sometimes the affected people actually fall victim to some of the unscrupulous people who are actually supposed to be helping them. We also do provide tailored training for frontline humanitarian workers. Again, we do this collectively with other partners who are responding in the humanitarian actions. But then I think in terms of our routine GBV programming is also critical in addressing some of the driving factors that actually promote SEH. When you look at issues like toxic masculinity, how do we strengthen positive masculinity? Again, we're working very closely with the governments, with partners. I'll give you an example. In February, in the Democratic Republic of Congo, we worked with the government to convene quite a big men's conference that again tried to bring men together to speak to what do we need really to achieve what we call positive masculinity. So in terms of we need to strengthen and integrate sexual exploitation and prevention of sexual exploitation and abuse and harassment in routine GBV prevention and programming, because there are quite a number of opportunities of work going on out there that we need to just ensure that that is mainstreamed. The other one is, of course, prevention of sexual exploitation and abuse is, again, it is sexual exploitation and abuse finds itself occurring in very dynamic situations, humanitarian situations, be it conflict, climate change related, displacement. Is quite a dynamic context with very many responders. So again, some of the interventions that we put in place, we actually constantly need to be looking back at what we did last time. Did it actually address the needs? So as part of that, in the year 2021, our executive director was the global champion for PSEAH. So we did a collective review on the progress made by the humanitarian community in addressing sexual exploitation and abuse. And in that review, which I'll happily share with the organizers of this town hall meeting, there are recommendations actually which factored on 2 key issues: that we need to institutionalize measures to prevent sexual exploitation and abuse, so that it doesn't appear that we are actually coming in to do something that, oh, we need specialized people, specialized resources to come. How do we prevent this abuse and exploitation within the available resources? And then that we actually need to really work on promoting, on instituting cultural change, because again, most of this happens because some of the societal dynamics that actually do promote these kinds of practices. I'll stop here for now. Like I said, again, it's collective action, and we really look forward to the rest of the discussion. I'll stop here for now. Back to you, Dr. Pitso.
Thank you, Dr. Ebele, and rightfully it is a joint effort. And I'm quite happy you mentioned a few things with regard to awareness, because so often people don't even know the difference between what is sexual harassment and also what is sexual exploitation, and where do we report, because we are so often, I mean, I think everybody is aware now, especially with gender-based violence. We need to make people aware of the platform. How do they report? Even to train our own healthcare workers how to manage survivors and victims of SIA, and how to, because you so often find them presenting in facilities, but they are even wounded. And when a victim comes, this is some of the issues that we need to enforce and encourage, even other stakeholders, in different organizations to form part of this joint. We can't do it alone. We need everybody to be part of it. Thank you so much. Lastly, just to also allow her to take a bite in this critical conversation is Wairimu. She is the Executive Director for Coalition on Violence Against Women in Kenya. Wairimu, also, just like the other previous speakers, I know your organization is quite responsive in terms of prevention of SIA. How are you engaging other sectors? We are talking a lot about stakeholder engagement, collaboration, joint efforts. How is your organization managing throughout all these years to achieve this?
Thank you, Dr. Pitso, and good evening, dear participants and fellow panelists. Now, the Coalition on Violence Against Women, COVAW, in Kenya has been around for 25 years. And we focus on addressing issues of gender-based violence. And the reason why I say 25 years is because from when we started up to until now, it has been important for us to evolve in the way we look at these issues. So I'll start off by talking about the recently concluded elections that we had in Kenya, because part of the reputation that we have as a country is unfortunate events of sexual and gender-based violence that happen during elections. Now, I bring this up because this is one of the ways that explains how COVAW has worked with other partners and stakeholders. Now, way back in 2008, we went to court on behalf of survivors of sexual and gender-based violence. And it is only very many years later, December 2020, that we got a judgment in court that ruled in favor of the survivors and also went ahead to accord some compensation for some of them. Now, this is significant because we see a situation where the importance of the state taking responsibility over law enforcement officials was to an extent upheld by the court. And this is important because for the longest time, issues of sexual and gender-based violence are not necessarily considered a national leadership issue or an issue of responsibility for leaders, for political leaders especially. So I'm happy to say that with the current election process that we have had, as an organization, we have received very, very, very few cases. And actually, the only cases we have received have been in relation to physical violence, not that it's a better option, but we haven't had cases of sexual and gender-based violence reported to us during this particular process as a result of the political process that we have just concluded. So for us, that is significant because we have been involved in prevention interventions for the longest time, and we have gone beyond investing only in community prevention interventions. We as an organization have also been calling on the need to look into our education curriculums, also to look at the curriculums that are used for health workers, because when you look at conversations around sexual and gender-based violence, when you look at SIA, normally these things come up much later in our lives when we have gone through a whole education system, probably even graduated from the university without ever having had the opportunity to really have and understand what these issues are about. And I think just like any other issues in terms of health, we have issues around malaria, we have issues around HIV and AIDS. It's about time that we ingrained these issues into our education curriculums from the earliest, so that we can start talking about prevention from the earliest opportunities that we have. Now, in terms of continued engagement with other stakeholders, we work with governments. And we not only work with government at the national level, where recently other partners have been appointed to the National Commission on Administrative Justice to look into reviewing the Sexual Offences Act of this country. We also work with county governments. And with county governments, our approach is that issues of SIA and issues of sexual and gender-based violence are development issues. We must look at them from that wholesome approach. And because they are development issues that touch on health, education, on mental health, what exactly are the county governments doing so that they can plan, but also budget accordingly for the gaps that we have at that level? Do the health facilities, are the health facilities adequately equipped with not only personnel, but also, counseling services, the ability to respond and also to prevent SIA at that level? Are we also looking at issues of women's economic empowerment, because that also adds to the agency and ability to make decisions, including moving away from unsafe spaces where women and girls would be exposed to exploitation and abuse? Now, one of the things that we also do is an appreciation that in terms of access to justice, it is one thing to have laws in a country related to the same SIA, but it is also one thing to ensure that those are accessible, that access to justice is accessible. And what we do as an organization is work with a team of pro bono lawyers. We also train community paralegals, because then that means that survivors who may not afford ordinarily, and access to justice is expensive across, and I believe not only in Kenya. So a lot of survivors will hesitate to pursue justice because they cannot afford it. And this is where we come in. And this is something that also plays out with other peer organizations that we work with. We look into issues of vulnerability as an organization. And for us, vulnerability, we have focused on issues of persons with disabilities, and not just disabilities, but persons with intellectual disabilities. Why? Because again, they are easy to take advantage of when it comes to SIA and SGBV. Again, we have a strategic litigation case going on in court, and we really hope for a positive outcome, because we have gone to court to challenge the penal code of this country that, one, refers to this group of persons as imbeciles and idiots, but also two, provides for lesser sentencing in the event of sexual assault. I mean, that is discrimination outright. And we're hoping that if we get a positive outcome in the courts, it will have ramifications across Kenya and beyond, other countries that have similar penal codes that they inherited from the colonial times. We've also been looking into issues of harmful practices that are precursors to sexual abuse and exploitation. And for us here in Kenya, one of that harmful practice is the issue of female genital mutilation. Female genital mutilation communicates that this girl is ready to be a wife, and she's ready to engage in sexual intercourse. You can pull her out of school, you can marry her off. So a lot of girls have been exploited and continue to be sexually abused just because they have been taken that rite of passage, quote unquote. So we are looking into those kind of issues. And then finally, to say that in terms of, again, and I come back to this, in terms of a development agenda, I think we have a gap, not only within the country, but also globally, because I think there is not much in terms of holding governments to account on how they deliver in ensuring that they are really working at reducing the incidences of SIA in their countries. And we continue to, to move on and to focus on what we consider to be tangible development issues of education, of health, of economic empowerment, and ignore this very, very important issue to the detriment of more than 50% of the population for many countries. And I think that's a huge one. Over to you, my UN colleagues. And then finally, internally as an organization, because that is very important. I think the assumptions that because an organization works on these issues, then we know everything is very wrong. So as an organization, we have continued to improve ourselves, looking into the policies that we have, adding on safeguarding policies, but also reaching out to other organizations to influence them, especially at community level, to develop safeguarding policies and practices that would enhance how they work on SEER issues. And then to say that finally, in terms of data, before I finish, data must be credible and data must be used to improve the situation on the ground. So there's a lot of conversations on data management, but we need to go beyond that to ask ourselves, are we really utilizing the data that we have to improve the situation, especially for women and girls that are exposed or are vulnerable to issues of SEER? I think I'll stop here for now. Thank you very much.
Thank you so much, Wairimu. You've mentioned quite a few important things that I like the fact that we need to include the education sector as one of the organizations that needs to take part in the fight against, because one other forms of SEERs we actually see mostly in children in the form of human trafficking, pornography. So I think involving the education sector to strengthen and make this aware, create awareness to our children at that level will also be one of the instrumental things that we do to address SEER. Thank you so much for a lot of work that your organization, I must say, is doing in Kenya. Thank you so much. To our panelists, I see now we have completed an hour, so we'll run quickly through some of the questions. In this next round, I'll allow each panelist at least 2 minutes to briefly just answer some of the questions. Dr. Sozi, coming back to you, for a couple of years, I mean, Dr. Magda Robalo has already mentioned the appalling, from the commission, the incident that happened in DRC, 83 cases, women were raped, children, and this sadly involving the World Health Organization, 21 perpetrators. This, how do we then put mechanism, coming from the United Nations to save our communities that we're supposed to, we are paid to protect? How does the United Nations, come up with mechanism to address this?
Okay, thank you very much, Dr. Pitso, and a very tough question, but one that in the 2 minutes, I'll try and address. I think maybe I'll just start off by saying that the majority, even where I am here in Ethiopia, the majority of the humanitarian workers identify as male. I can go to every region in this country, and I'm the only woman in the room, whether it's a meeting with government, whether it's meeting with our UN colleagues, on whether it's NGOs, both international and national NGOs. So encouraging agencies to work towards gender parity must be something that we need to advocate for. But the principles are the same. Prevention lies at the core of our strategy. And the first one is around screening, making sure we've got the right people to work on these issues around people who need protection. And as of a collective, we agreed that screening for any new staff is mandatory, meaning that the human resource procedures for all entities would include the agency responsibility to check on a blacklist and check references with specific mention of SEAH. So it's not just a blanket mention, but specifically. This seems to work across UN entities, across UN to UN, but not so across UN and other non-UN entities. But I do know that members of the Interagency Standing Committee, the IASC, sign off on this, which includes international NGOs. And so it's a push that I need to continue. In addition, all staff, no matter what the position is, including contract workers like truck drivers, for instance, including actual heads of agencies and country directors of NGOs, have to sign a mandatory code of conduct as part of the contract. And it's not just a sign off, but it includes the UN heads or the HR to have a discussion on what this actually entails at that point in time. And then, of course, training, and training. The heads of every entity, the UN in particular, plus the humanitarian country team, are trained on the PSCH protocols for investigations, for survivor-centered principles, everything that we have talked about. It is part of, it's a mandatory training, and anybody who's coming in new would go through the same process, with the network being responsible, and myself. The network has also got a responsibility to ensure that every UN and humanitarian staff, new or existing, receives the training on the UN standards of conduct on the fight on SEAH before and after deployment. And they sign off on this. Zero tolerance is zero tolerance. There is some UN online training, but there's also face-to-face training in the field. The agencies do this, and at this moment in time, WHO is in the field, moving from region to region, doing this with their staff, WFP, UNHCR, and the training defines, as somebody said earlier, what SEAH is, and reemphasizes what zero tolerance means, and defines our responsibilities to address the impacts and empower victims and survivors. We also talk of the mandatory active bystanders expectations, and this is something that is part of the contract of every staff member, and reinforces that whistleblowers will be protected, ensuring that the process of documentation in particular does not harm the individuals who are bold enough to report. But we also inform them that if anybody is even whispered an alleged perpetrator, they will be withdrawn immediately. And I have received complaints and talked to the head of agency, and that has happened. It's important to act straight away. And then the outreach and awareness raising in communities. And I'm glad I've got colleagues online who are much more versed in this, because I think for me, this is the most difficult part. I said earlier that we had established sub-regional networks with communities, UN working with NGOs, and to inform the government authorities, to ensure public awareness raising about and explaining what is unacceptable behavior by UN staff and humanitarian personnel. Very difficult when men are talking to each other, but it's important that we keep reinforcing these issues and also talking about what they can do when people report, including the support to survivors and the accessibility to some of the issues of legal advice and other support services. We have worked hard in this, but it's very difficult when you go into the areas where conflict is, for instance. Conflict is actively happening and people move all the time. We try to keep up where people are. And sometimes the people are in the middle of nowhere where they have no access to some of the routine services that would be. And so humanitarians are trying to fit in and fill in a gap where there's very little connection to the zone authorities, who usually have no idea what is happening and have not signed on to it. But getting in place some, putting in place some safe community-based complaint reception mechanisms where the people are is proving to be a big challenge to us, and we rely very heavily on the cultural leaders, the religious leaders, who inevitably in a lot of the places around this country are also men, around the clan leaders, the religious leaders. And so you can see that the battle on trying to change is constant. We have learned that we need to pay special attention to underserved and very remote areas, and we will continue. But as I'll stop there, but I just want to say that our response rate is still low. But the issues that are being said around this table is exactly what means that we just need to make sure we continue. Thank you very much.
Thank you so much, Dr. Sozi. Unfortunately, this is one of the critical topic, that is facing, especially coming to the under-representation of women in leadership position. That's one of the root cause of CA and the fueling motivator for this particular topic that we're doing today. I'm looking at a time. Our panelists, may I ask that I will not just to allow other panelists to also have to give us some insights. Masana, you mentioned a number of activities that your organization has already embarked on. So are there any more or any other activities that you would like to put forth, that you're making any governments or any accountable for protecting the most vulnerable in South Africa?
Thank you so much, Dr. Pitso. And I'm looking at the time. I will try and stick within that bracket. You know, I think some of the things that we're realizing, and it's evident in the conversation, there has been a big uptake across the continent of more women in leadership positions. So representation, representation, representation. But we know representation is an insufficient safeguard for transformative policies and impact. In fact, what we're seeing is that a lot of times women in leadership positions, particularly when there's cases of sexual harassment or gender-based violence, are actually silenced and cornered, and there are high levels of intimidation. And responding to that is, I think, one of the biggest challenges we face in the sector. You know, we have colleagues who are intimidated by influential politicians or perpetrators with connections, and they have connections throughout the system, from the police through to the courts, right? So I think that there's a lot of work that needs to be done, you know, especially in light of Convention 190 on safeguarding and protection within the world of work. One of the things that we have been trying to work more and more on is, what does it mean to push for representation and transformative feminist leadership, so that not only are institutions saying to women, come into our institutions, help us respond to sexual harassment and exploitation and abuse, but also that those institutions are doing the work of preparing themselves for that change. Because in fact, what we're doing is we're putting a lot of women at risk for further marginalization and violence when we bring them in to take on this transformative agenda, not realizing how influential patriarchy is. Then one of the last things that I want to say is, you know, at the heart of what drives gender inequality across the world, we know, for example, that climate injustice will lead to higher levels of gender-based violence. Sonke did a study that showed that levels of hunger, higher levels of hunger, lead to higher levels of gender-based violence, COVID-19, economic recession, et cetera, is that we actually need to implore not only of our governments, but also our institutions to take a whole systems approach. So not only ensuring that individual men are held accountable, but even in the structures and the policies and the processes that we enact and the campaigns that we push for, and the partners, business or otherwise, with whom we work, align wholly to that mission and that agenda, so that there's consistency in achieving gender equality. Thank you.
Thank you so much, Masana. I'm moving on to Dr. Ebele. Just quickly, Dr. Ebele, your organization, how is it coordinating other stakeholders, such as including the United Agency, WHO, and other civil organizations in the health sector?
Yeah, again, thanks, Dr. Pitso. I'll be brief. I think there are three key things we are trying to undertake as an organization. But again, like I said before, we work, it's collective effort. I think one is to have a common understanding of what is sexual exploitation, abuse, and harassment. That is critical to any interventions we are going to undertake, because without that, then we are going to spend a lot of time in debates. So it's having a common understanding is very critical. And then secondly, we are trying to work with other organizations to see in each of the sectors, if it is in education, if it is in food security, if it is in water sanitation and hygiene, if it is in protection, what are those, what are those loopholes, those gaps that, that the abusers exploit? And then can we come up with very, very definite action that we need to plug those loopholes? Because again, prevention, like Dr. Catherine said, is really key. And then the third and the last one is really looking who is most vulnerable among the vulnerable. Because again, access, availability of response is one thing, but one of the key things that we find out, is why we have people not coming out to report is the fear of, if you are reliant on humanitarian aid, the mere fear, that coming out to report somebody is going to, to stop your food rations, to stop your, your water and hygiene and sanitation support. So how do we reassure, the community that there will be continuity of services, even as we try to address this elephant in the room? So those, I think, 3 critical actions that we need to take together, and then we'll begin to see a bit the brighter side of all this. Thanks.
Thank you, Dr. Ebele. Wairimu, you've mentioned that part of your organization's effort is to strengthen the legal system and to assist the victims to access, the relevant legal platform, right, and to report incidents of SEER. So is there any other intervention that you are currently engaged in, so that just quickly, briefly, just tell us some of the intervention that you are assisting the vulnerable with regards to the justice system?
Thank you. I'll highlight 2 areas that we have found to be important. One is undertaking research, credible research, and sharing the findings with institutions like the judiciary and other stakeholders, because sometimes it's important that they see, they're able to understand what and how we perceive from out here, but also giving them the opportunity to also tell us what the challenges are in there that prevents them from facilitating access to justice for survivors. It helps us as CSOs appreciate that, and move away from the blanket application of judgment in terms of the weaknesses of some of the institutions that we have been vested with the responsibility for addressing issues of SEER, towards a collaborative approach, so that we are complementing each other, both as government and CSOs. Now, 2 is looking at the gaps that exist within the referral pathways and reporting mechanisms. Those are very well clearly articulated by many stakeholders, including ourselves, but then there are gaps in there. For example, one of the biggest gaps that we have, and was very glaring during the COVID-19 response, was the issue of availability of shelters. So if you have cases where you have survivors who need to be taken away to a place of safety, where do you take them? Because that has huge implications for work, for the work that we do as COVAL, or for players that are in the sector. When you do not have safe spaces that you can refer survivors to, that has huge implications. And that also means that we have a lot of survivors who continue to remain in spaces that are unsafe because they have no alternatives in terms of where they or in terms of where they can go to. And this is a problem that the government has also said that they have. They do not have shelters. We have pushed back and said you have a responsibility to provide shelters, because that's the only way this is going to be sustainable. And then finally, to say, and I go back to my earlier point, the issue of prevention with long-term sustainability in mind is critical. And though it might be difficult, a review of curriculums can be very political. There's a lot of gatekeepers when it comes to education curriculums. We must push to have our curriculums reviewed so that we can start having these conversations early enough for us to understand what SEER is, for us to understand what SGBV is, way before we get out into the world and have to deal with it as a crisis. And then finally, maybe a recognition, and this we have been talking about, is the role of women's rights organizations like COVAL and where they sit when it comes to responses. When it comes to humanitarian responses, women's rights organizations are expected to be present and to play a role. without the acknowledgement and the appreciation that they too need support in terms of understanding how to deal with SIA, especially in humanitarian context. Because if you look at the history of most of them were established for development purposes. They do not have, they have not been involved in the past, and they have not been considered in the past as important stakeholders until recently, when, for example, countries could not get in emergency teams. For example, during the cases of Ebola, again during COVID-19, when mobility was restricted and INGOs and UN agencies needed to get development, humanitarian aid down to the grassroots. And so the women's rights organizations were available. That the availability is not the problem, but I think there needs to be an acknowledgement that that also comes with the requirement of resources, but also the requirement of capacity building so that they can wear the hat that they're expected to wear. Shifting between development and the humanitarian accesses.
Thank you so much, Wairimu. Apologies to interject. I will quickly now open for the live Q&A questions, just to allow just one of our participants to raise a question to our panelists. I'll also just read one message from one of the panelists. Thank you, excellent remarks from the panelists. This is her question. What do you think explains a low uptake of the same in the institution of higher learning, at least in practice? And how do we carry over these practices, which they are embedded in the social fabric as well? Any of the panelists, just 2 minutes to answer this question.
Sure, so I'm happy to come in. We have done quite extensive work with institutions of higher learning. And I think this has sort of been skirted around, but mentioned in the conversation that we've had, the importance, first of all, of existing safeguarding policies, but also an independent whistleblower who is able to investigate cases far removed from any intervention or approach. Some of the challenges that we've seen, of course, in institutions of higher learnings is that, much like for other cases, particularly where there's a power imbalance that exists within the case of exploitation, of sexual harassment, of abuse, is that there is oftentimes the fear of reporting. And oftentimes for institutions of higher learning, again, access to services where there are resource constraints, particularly for victims or survivors, means that these are only only begin at the point of reporting, where they exist, if at all. And I think that there is more to be done in terms of designing and creating a holding infrastructure for those within institutions of higher learnings to, again, abide by and apply the principles of Convention C190 to apply and develop their own safeguarding policies and mechanisms that also, at the moment of allegation, removes the person who is being investigated from that site. I think finally, there's also a fundamental need in that process to ensure that there is already within these institutions a gender transformative approach to interacting, so that the culture, there's a zero tolerance culture, but also there's an understanding of what it means to apply and disperse and implement gender equitable relations that don't then subject someone to sexual exploitation and harassment within that context. Thanks.
Thank you, Masana, for answering that question. To our participants, you may raise a hand if you have a question for our panelists. I'm quickly going to check there's no question from our participants.
There is some question. Dr. Amina, can come in.
Yeah.
She raised her hand. Dr. Amina Ali.
Oh, hi. It's not actually Dr. Amina, it's Gisela. She's the one who invited me to be part of this meeting. I'm so sorry. So good afternoon, panelists. My name is Gisela Bwalia. I'm from the Republic of Zambia. I run an NGO that is focused on gender-based violence called the Center for Research, Consultancy and Advocacy on Gender-Based Violence. And I just want to share just a little piece about my experience in the field with working with different people in different communities, especially in rural areas. So, one thing I've come to understand is that I feel one aspect you really need to invest in is education. I've worked in communities where there's some women who still believe that if the husband doesn't beat them at home, then he doesn't love them. There are also some communities that still believe that a girl child is just born to be married. So when a girl child is born to be nurtured until they're married off, education is then not important in that event, but the boy child will be given access to education. So I feel one most important thing is, fostering education and a mindset change, especially in those areas. So the cultural dynamics also kicks in. So in as much as culture is important, but we also have to look at certain cultural beliefs and certain cultural practices that do not help the situation. So I still believe that any cultural belief or any cultural practice that does not promote life should be discarded. Because if we continue to continue upholding these beliefs, then we are taking away, from young girls and taking away from women who are supposed to be, up there. So I feel investing in education, I feel is very vital. So I think we really need more, mindset change programs in rural areas, especially, so that we are able to bridge the gap, between men and women. Thank you so much. And then my other last comment is, how can we collaborate? Because I run this organization in Zambia, and I'm hearing from Ms. Wairimu from Kenya, and I'm hearing from Ms. Masana, I'm hearing from Dr. Catherine, and from Dr. Michael. And I'm thinking to myself, Lord, I've been working alone like this. How can we collaborate? How can we work together to ensure that we push this agenda forward? Thank you so much.
Thank you for your question. Our panelists will quickly answer. And I think that was one of the aim for this discussion and webinar, to enforce networking and collaboration moving forward. Thank you. I think, Catherine, you may quickly just respond briefly before we move on. Anyway, yeah, if you have any thoughts on this comment, yeah.
So you want me to respond to the question on the screen? Sorry.
From my side, I'm not really seeing any questions, but panelists, you may answer the question looking at the time directly on the Q&A box.
Okay, maybe the question I see from somebody called Betty Namataka, asking me on how does she get through the guilt trip of reporting someone. And I think I think for me is to really think of the victim rather than the person you want to report, and think of the impact that the SCAH will have on that person, which is lifelong. So empathy is what I would put at the front. But of course, I think that your concern is really around, if it's about you, fine, about whether you've got confidentiality, whether there's a discreet person you can inform. Those are some of the challenges where you get protected as the whistleblower. But if it's about them losing their livelihood, I'm sorry, I don't really have any sympathy for anybody who conducts SCAH. Thank you.
Thank you so much, Catherine, and also to all the participants. If you have any more questions that are not addressed today on this platform, please feel free to use and send us and use the email address on the chat box, and then we'll send you the answer through email. thank you for the panelists. I think we're at the end of our discussion. Just briefly giving all the panelists 1 minute for closing remarks with these questions, just to answer the most critical policy measures global health actors can take to end SIA in health sector. Masana, go first.
That's a tough question. Well, I think for starters, there does need to be the existence of an independent, coordinated oversight mechanism, including a whistleblower mechanism within the healthcare sector. And I think it needs to apply across the board, you know, much like for insurance purposes in South Africa, there's an oversight mechanism and body. I think that needs to be strengthened and held by independent medical practitioners, but also those associated with institutions, and that there needs to be clear evidence, also recognizing obstetric violence, for example, as part of a SIA crisis. And then lastly, I think that I work very closely with grassroots community health workers on what does it mean to apply a feminist economics and gender transformative lens. You know, I think that we need to apply this knowledge across the board and not only within institutions of higher learning as a pedagogy. Thank you.
Thank you very much, Masana. Dr. Ebele, take the floor.
Yeah, thanks, Dr. Pitso. Yeah, so I think mine is really, again, I'll speak about prevention, but when speaking about prevention, I'll speak about awareness raising. I think it's important that all of us pick this up, but more importantly, you know, the duty bearers, the member states. I come from Uganda, and at one point in time, the main discussion was around, you know, under the table payments in the health sector. And there was so much advocacy around that it generated a lot of debate to the causes of it, to the negative impacts of it. And that way, you know, people were able to put the various people accountable to, you know, to address some of the causes, but also, you know, actually respond to this, to the victims of under the table payments. So we can do the same for sexual exploitation and abuse and harassment. Thank you.
Thank you, Wairimu.
Thank you, Dr. Pitso. I think a lot has been said, but for me, one is that we need men as allies, especially men in leadership positions in the health sector, to speak out against SIA in a more louder, definite voice than they have done. And then two, let's look at catching them young. Let's look at catching people young in terms of prevention and awareness raising around SIA and SGBV. Thank you.
Thank you, Wairimu. Dr. Catherine?
Thank you, Women in Global Health. I think that you need to continue this and create a movement, a real strong movement on SCH, and this is the beginning. Please use the United Nations. This is the job of the UN. Global accountability. Somebody said the UN was not created to take mankind to heaven, but to save humanity from hell. SCH is hell. And I think you need to hold us accountable. In every country on this continent is a job like mine. And my job is to do what I've said we do. So I think that connecting with everybody around the room is a must. And then, so that's within the UN. But on outside, I think the main challenge is for the survivors and to work hard to break their silence safely and effectively. But the work that the development partners, the women networks do around changing patriarchal norms, scaling up, addressing gender inequalities, and please don't forget women with disabilities, children, and strengthening the legal and policy framework is key. And that is a development agenda. Thank you.
Thank you, Catherine. Thank you very much to all our panelists. Thank you for your time today. Thank you for reaffirming to reach the zero tolerance and preventing SEER. And thank you for reaffirming the need for accountability. I will now hand over the stage to Dr. Mariam Dahir. She is a co-founder of Women in Global Health Somalia, for closing remarks. Dr. Mariam is a medical doctor and a public health specialist with extensive experience managing programs of HIV, maternal and child health, and sexual reproductive health, family planning, and she's also a champion of the health for all in her country. Mariam, please go ahead.
Thank you so much and good evening, dear distinguished guests, speakers, attendees, Women in Global Health and different chapters of Women in Global Health. I appreciate to have this collective town hall about the sexual exploitation, harassment, and abuse. At this timely discussion, Women in Global Health Somali chapter is pleased to collaborate with other chapters, specifically South Africa and Women in Global Health. Gender-based violence, including SEER, is still a major issue in humanitarian settings, including Somalia. It is a post-conflict and conflict-affected areas, such as displacement settings. GBV and SEER continues to be an issue of a great concern in every setting, especially in humanitarian settings. Women and adolescent girls living with disabilities are subjected to violences, harassment, abuse in each setting, especially in humanitarian. Somalia is a humanitarian setting which experiences recurrent climate shock. Recently, the drought that affected most of the country, that affected mainly women and children, which exposed them to many violences such as GBV, sexual abuse, harassment, and exploitation. Unfortunately, there is an underreporting of those cases. Low attention from the stakeholders, mainly the drought responses and COVID-19 response was on prevention of COVID or supplying the food and water, leaving behind the protection interventions. Furthermore, Somalia is lacking women at the decision-making tables and leadership sphere, which leads to humanitarian response gender blind. Women health professionals are facing many challenges, including inequality, low pay, lack of policies protecting them, and culture that is mainly misogynist and patriarchal dominant, which makes them silent. That also they can't report, or they don't have any whistleblowers, and there is no policy against SEER and any other gender-based violence forms and types. We never had any case reported in healthcare setting about SEER. That means there is cases that's going on, but women are silenced. The action to be taken is to address the SEER firstly, to empower the women to speak up, training them, and putting awareness raising, and also going down and to the level to frontliners, because frontliners are silenced by many ways. Putting policies to protect, as well as advocating to have a code of conduct, to also to introduce that in any setting, especially healthcare. Whistleblowers to be encouraged, as well as I said earlier, the reporting and the information for that is very low. So improving the GBV information system is important. Finally, we need to enhance advocacy and engage in the decision makers. We need many town halls to discuss and put together NGOs, movements, activists, UN, and government to take the action and protect. Let us speak up, let us take actions, and let us all be activists. I thank you.
Thank you so much, Catherine. I will now hand over to Dr. Magda Robalo, the Director of Women in Global Health, for her last remarks and closing. Thank you, everybody.
Thank you so very much for just excellent moderation and for all our inspiring speakers for an absolutely fascinating panel. I will not add anything to what has been said, just to confirm that indeed Women in Global Health will continue to do this work, because for us it is important to put women at the center of what that we do, whatever we do in global health, and protecting women from sexual exploitation, abuse, and harassment is an important part of our work. We will continue with this advocacy work, awareness creation, and then promoting coordination among and across the different actors on the ground. I will not take more of your time, but a big thank you to the participants, to the experts and panelists who contributed to a fantastic panel today. Thank you very much, and the work continues. Thank you.
Thank you, everyone. Goodbye.
Thank you very much. Bye.
Thank you.
Goodbye.